Before we go any further, I want you to check something right now. Have you ever felt tingling in your feet, like pins and needles? Or maybe a burning sensation at night when you're trying to sleep? What about dry, cracked heels that never seem to fully heal? Most people ignore these. They say it's just age. But what if it's not? What if your feet are trying to warn you about diabetes long before any doctor ever tells you? Here's something that might surprise you. In many cases, diabetes doesn't start with a diagnosis. It starts with small signals your body sends quietly. And the very first place those signals often show up is your feet. Now, let me ask you something. Have you noticed anything unusual with your feet lately? Even something small? Because if you have, I want you to stay with me. This could be more important than you think. I've seen this happen too many times. A patient walks in feeling completely fine. No major complaints. No reason to worry. But when I ask one simple question, how are your feet? Everything changes. Not long ago, I spoke with a 67-year-old man. He was active, living a normal life, no major health concerns. He came in just for a routine visit. Before running any tests, I asked him about his feet. He said they feel a little numb sometimes. I figured it was just getting older. That one sentence changed everything. Because when we checked his blood sugar, it was already dangerously high. He had been living with diabetes for years, without knowing it. And here's the part that really matters. His body had been warning him the whole time. He just didn't recognize the signs. That's exactly why this video matters. Because right now, there are millions of people experiencing these same symptoms and brushing them off as nothing. Today, I'm going to show you 9 warning signs that often appear in your feet first. These are the same signs I look for in my patients. The same signs that show up months, sometimes years, before diagnosis. And as we go through them, I want you to think about your own experience. If something sounds familiar, don't ignore it. Also, I'd really like to hear from you. How old are you, and have you noticed any changes in your feet recently? Go ahead and share that in the comments. I read them, and it helps me understand what you're going through. Now, let's start with the first sign, because almost everyone has felt it, but almost no one takes it seriously. Sign number 1, tingling and numbness. Let's start with the most common sign of all. And I want you to think carefully about this one. Have you ever felt that pins and needles sensation in your feet? That light tingling? Or maybe a numb feeling like your foot just fell asleep? Most people immediately explain it away. I was sitting too long, my leg was crossed. It happens sometimes, and yes, occasionally, that's completely normal. But here's the real question I ask my patients. Is it happening regularly, without a clear reason? Because that's when it stops being harmless and starts becoming a warning sign. What you may be feeling is something called peripheral neuropathy. Now, don't let the name intimidate you. Let me explain it in the simplest way possible. Think of your nerves like electrical wires. Every wire has a protective coating around it. That coating allows signals to travel smoothly from your brain down to your feet. But when blood sugar stays high over time, it slowly damages that protective layer, almost like acid wearing it down. At first, nothing seems wrong. The signals still go through, but they start getting fuzzy, unclear, distorted. And that distortion? That's the tingling you feel. That pins and needles sensation is not random. It's your nerves struggling to communicate properly. Here's what makes this so important. This is often one of the earliest signs of diabetes-related nerve damage. In fact, nearly half of people with diabetes experience this at some point. And for many, it starts quietly in the feet. Now let me ask you something honestly. Have you felt this more than once recently? Not just once in a while, but often enough that you've noticed it? Because if you have, this is not something to ignore. The good news? There's something simple you can start doing today, and it makes a real difference. Take a 20 to 30-minute walk every day, keep it gentle, no need to rush, just consistent movement. Walking improves blood flow to your feet. And those nerves? They depend on good circulation to stay healthy. And here's the second step, just as important. Start reducing added sugar in your diet. Even small changes matter. You don't have to be perfect, but you do have to be aware. Because once nerve damage progresses, it becomes much harder to reverse. So catching it early? That's everything. Now, the next sign. This is the one my patients say is the most uncomfortable. It doesn't just show up during the day. It hits at night, when everything is quiet, and there's nothing to distract you from it. Sign number 2, burning feet at night. Now, let's talk about the second sign. And this one is the one people remember, because it's not just noticeable, it's uncomfortable. Sometimes even unbearable. Have you ever laid in bed at night, trying to fall asleep, and suddenly your feet feel like they're burning? Not warm, not tired, but actually burning. Many people brush this off too. I was on my feet all day. Maybe it's the heat. I'm just getting older. And yes, sometimes that's true. But when this burning sensation shows up at night, repeatedly, that's when it becomes something else. What you may be experiencing is again related to peripheral neuropathy, but at a more advanced stage. Here's what's actually happening inside your body. Your nerves are damaged. And instead of sending normal signals, they start sending false signals. Your brain receives a message that says something is hot, even though nothing is touching your feet. Let me give you a simple way to understand it. Think about a smoke alarm. If the sensor is damaged, it can go off in the middle of the night, even when there's no fire. That's exactly what your nerves are doing. They're misfiring, sending alarm signals when there is no real danger. And that burning feeling, that's your body's alarm system going off unnecessarily. Now, here's what makes this even more important. This symptom often shows up years before someone is officially diagnosed with diabetes, sometimes 1 to 3 years earlier. So imagine this. Your body has already been warning you, long before any doctor ever tells you something is wrong. Let me ask you something. Have you ever kicked your feet out from under the blanket at night just to cool them down? Or struggled to sleep because your feet felt uncomfortable for no clear reason? If that sounds familiar, don't ignore it, because once nerve damage reaches this stage, it's no longer just a small signal. It's a louder warning. Now here's what you can start doing immediately. Simple steps, but powerful. Drink at least 8 glasses of water daily. Hydration helps your body flush excess sugar and supports nerve health. Add more fiber to your meals, vegetables, beans, oats. These slow down sugar absorption. These are not complicated changes, but they directly reduce stress on your nerves. And here's the truth. The earlier you respond to these signals, the better chance you have of preventing long-term damage. Because if ignored, this burning sensation can eventually turn into constant pain or even complete numbness. Now the next sign. This is where things become serious. Not just uncomfortable, not just annoying, but dangerous. This is the one that sends people to the emergency room. And most of the time, it started as something very small. Let's talk about that next. Sign number 3, slow healing wounds. Now we're stepping into something more serious. This next sign is not just uncomfortable. It can become dangerous very quickly. Let me paint a picture for you. A small blister, maybe from a shoe, maybe from walking a little too much. Nothing unusual, right? You've had those before. We all have. But here's where things change. That small blister doesn't heal. Days go by, then weeks, and it's still there. I've had patients sit across from me and say, I thought it would go away on its own. They always do. And that's true, unless blood sugar is elevated. Because when your blood sugar stays high, your body's ability to heal starts to break down. Let me explain this in a simple way. Your blood carries everything your body needs to repair itself. Oxygen, nutrients, infection-fighting cells. Now imagine trying to send all of that through a garden hose. But the hose is bent and squeezed. That's what high blood sugar does to your blood vessels. It narrows them, stiffens them, slows everything down. So even though your body has what it needs to heal, it can't deliver it to your foot fast enough. The wound just sits there, open, exposed, vulnerable. And this is where the real danger begins. Because an open wound is an invitation for infection. And infections in the feet, especially in people with diabetes, can escalate quickly. In fact, one of the leading causes of amputation starts exactly like this. Not with something dramatic, but with something small that was ignored. Now I want you to think honestly for a moment. Have you had a cut, blister, or sore on your foot that took longer than expected to heal? If the answer is yes, that's not something to brush off. Here's what you should start doing beginning tonight. After your shower, sit down and check both feet. Look carefully, heels, soles, and between toes. Don't rush this. If you find anything, clean it gently with soap and water. Apply an antiseptic, cover it properly, and here's the most important part. If it doesn't improve within 48 hours, call your doctor. Not next week. Not, let's wait and see. 48 hours. Because when it comes to wounds and circulation, time matters more than people realize. Catching it early can mean the difference between a simple fix and a serious complication. Now the next sign. This one is quiet. It doesn't hurt. It doesn't burn. But it's visible, right in front of you. And most people miss it completely. Sign number 4. Skin color changes. Now this next sign is one of the easiest to see. but also one of the most ignored because it doesn't hurt. There's no discomfort, no burning, no tingling. It just shows up quietly, right in front of you. I'm talking about changes in the color of your skin, especially around your feet and ankles. Many people notice this and immediately assume it's just aging, maybe sun damage. My skin has always looked like this, and sometimes that's true, but not always. There's a very specific pattern I want you to pay attention to. Darkening around the ankles, a reddish or purplish tint, even a slight bluish tone in some cases, these are not random changes. They're signals. And what they're telling you is simple. Blood is not reaching your feet properly. Let me explain this in a way that makes sense. Think of your blood like a delivery truck. Every second, it's carrying oxygen, nutrients, everything your tissues need to stay healthy. Now think about your feet. They're at the very end of the longest route in your body, furthest away from your heart. So when something goes wrong, your feet are the first place it shows up. When blood vessels are damaged, often due to high blood sugar, they start to narrow. Flow slows down. Delivery gets delayed. And when your skin doesn't receive enough fresh oxygen, it changes color. That darker or reddish appearance. That's not just cosmetic. That's your body sending a visible distress signal. In some cases, the skin may also become thinner, more fragile, easier to injure, which makes everything we talked about in the last section even more dangerous. Let me ask you something. When was the last time you actually looked at your feet closely? Not just a quick glance, but really looked? Because most people don't. And that's why this sign gets missed. Now here's what you can start doing daily. Simple. Takes less than 5 minutes. Do ankle circles every morning, raise your toes up and down. Stretch your calves gently. That small movement improves circulation. Even a little effort goes a long way. And if you spend a lot of time sitting, elevate your feet slightly when you can. This helps blood flow back properly instead of pooling. Because the truth is, your body is constantly communicating with you. The question is, are you paying attention? Now the next sign. This one surprises almost everyone because it looks completely harmless. Most people think it's just dry skin, something they've dealt with for years. But in some cases, it's much more than that. Let's talk about that next. Sign number 5, cracked heels and dry skin. Now this next sign, almost everyone has experienced at some point, which is exactly why it gets ignored. Cracked heels, dry, rough skin on your feet. Most people immediately say, it's just dry weather, happens every winter. I just need a better lotion. And yes, sometimes that's all it is. But here's where you need to pay attention. If your heels are cracking deeply, not improving with moisturizer, showing up even in warm weather, that's a different story. Because this may not be a skin problem at all. It may be a nerve problem. Specifically, damage related to diabetic neuropathy. Let me explain this simply. Your body has a system of nerves that control things automatically. Things you don't even think about. Like sweating, moisture balance in your skin. These are called autonomic nerves. And when blood sugar stays high over time, these nerves can become damaged. When that happens, your sweat glands stop working properly. Your feet stop producing natural moisture from the inside out. So what happens next? Your skin dries out. It loses flexibility. And eventually, it starts to crack. Now think of your skin like a brick wall. Healthy skin is sealed tight, strong, flexible. But when moisture disappears, that seal starts to break. Cracks form. Small at first, then deeper. And those cracks? They're not just cosmetic. They're openings. Open doors for bacteria, for infection. And remember what we talked about earlier. When circulation is poor, your body struggles to heal. So something as simple as dry skin can turn into something serious. I've seen patients come in with heel cracks so deep, they were bleeding. And for years they thought, I just need more lotion. But lotion doesn't fix nerve damage. Let me ask you honestly, have you been dealing with dry, cracked heels for a long time? And no matter what you use, it just keeps coming back? If yes, that's something you should take seriously. Now here's what you can start doing immediately. Moisturize your feet every night before bed. Use a good lotion or even natural oils like coconut oil, but very important, do not apply moisturizer between your toes. That area traps moisture. And too much moisture there can lead to fungal infections. And don't forget this. Drink enough water daily. Hydration isn't just about thirst. Your skin depends on it. Because real healing starts from the inside. Now up to this point, we've covered 5 signs. 5 different ways your body may already be warning you. So let me ask you something directly. Have you noticed even one of these signs? Because if you have, you're not alone, not even close. But the next sign, this one goes beyond nerves, beyond skin. This one involves something deeper, something that affects your entire body. Let's talk about that next. Sign number 6, swelling in feet and ankles. Now, this next sign is one many people notice, but very few take seriously. Swelling in the feet and ankles. You might see it at the end of the day. Your socks leave deep marks. Your shoes feel tighter than usual. And most people say, I've been standing too long, I was sitting all day. That's normal at my age, and sometimes it is normal. But here's where you need to pay attention. If the swelling is happening regularly, getting worse over time, not going away after rest, then it may be something more serious. Because this is not just about your feet anymore. This could be a sign your kidneys are under stress. And that stress is often linked to diabetes. Let me explain this in a simple way. Your kidneys act like a filtration system. Every drop of blood in your body passes through them. Their job is to remove waste. Balance fluids, keep everything stable, but when blood sugar stays high for too long, it damages those filters. And when that happens, your body starts holding onto fluid. That extra fluid has to go somewhere. And because of gravity, it collects in your feet and ankles. This condition is called edema. Here's a simple way to recognize it. Press your finger gently into your ankle. If the skin stays indented for a few seconds, that's called pitting. And that is not something to ignore. Let me ask you something. Have you ever taken off your socks at night and noticed deep lines on your skin? If yes, that could be your body telling you something important. Because swelling is not just discomfort. It's a signal that your body's filtration system may not be working properly. Now here's what you can start doing right away. When sitting or resting, elevate your feet. Even a small pillow can help reduce salt, sodium. In your diet, too much salt makes your body hold on to more fluid. Start reading labels. You'd be surprised how much sodium is hidden in everyday foods. And one more thing. If the swelling is new, persistent, or getting worse, bring it up with your doctor. Don't wait, because early action can prevent bigger problems later. Now the next sign. This is the one that confuses the most people, because it feels like something else entirely. Most people think it's arthritis or an old injury, but in many cases, it's neither. We've covered a lot today, and I want to take a moment to bring this all together for you. Right now, your body may already be sending signals, not loud ones, not dramatic ones, but quiet, consistent warnings. Let's quickly remember what we talked about. Tingling or numbness, burning sensations at night, wounds that don't heal, skin color changes, cracked heels that won't improve, swelling in your feet and ankles, sharp, unexplained pain. These are not random. They are messages. And in many cases, they are early signs of type 2 diabetes. Here's the part most people don't realize. By the time a diagnosis happens, these signs have often been there for months, sometimes even years. Not because people didn't care, but because no one told them what to look for. Now you know, and that gives you something powerful. Time. Time to act early. Time to protect your health. Time to stay independent and strong. So here's what I want you to do. Not tomorrow. Not next week. Tonight. Take 30 seconds. Sit down and really look at your feet. Check the skin. Look between your toes. Notice any changes. Pay attention to how they feel. Just 30 seconds. That's it. And if you notice anything we talked about today, call your doctor. Because something as simple as a basic blood test can give you answers. And those answers can change everything. Now, before you go, I want to hear from you. Have you noticed any of these signs? Even just one? Go down to the comments right now and type yes. Or share what you've been experiencing. Your story might help someone else watching this. Realize they're not alone. And if this video helped you, do 2 simple things. Hit the like button, subscribe to the channel. It might seem small, but it helps this information reach more people who truly need it. And if there's someone in your life, a friend, a spouse, a parent, share this video with them. Because sometimes, the right information at the right time can change a life. Take care of yourself. Stay aware. Stay proactive. And don't ignore what your body is trying to tell you. I'll see you in the next video.